I'm with Victress Health and Wellness, and we're really excited to be here again today. Got to come a couple months back to talk about gut health, and what we really wanted to focus on today is talking about anxiety, depression, ADHD, and we'll kind of get into, again, that mental health side that we already spoke about, but then also some of the chronic diseases that we're seeing with brain health, so Alzheimer's, Parkinson's as well. So really excited to be here today. This is our nurse practitioner in the middle. Her name's Danielle. She's fantastic. I don't know if I can let me see if I can get this off of here. Sorry, guys. Without messing something up. X. Seems like it would be the logical choice. There we go. So Danielle's our nurse practitioner. She leads our direct primary care. We'll talk a little bit more about that later. My sister, yes, we are related. We get that question a lot. My sister is Dr. Lisa Marino, and she founded Victress, we're almost 6 years now. So disclaimers, we always like to start with this just so you kind of know what's going on. Everything that we talk about today is for your information and it's for education only. We definitely want you discussing this with your care providers. Please discuss, again, this in conjunction with your specific needs with your care provider. And then we also do have a supplement store. And so I always put that up there because I'm not here to sell you supplements. I'm just here to give you a venue to be able to know, hey, these are good products. This is something that you could choose potentially if it meets your needs, okay? So we'll talk about that a little bit more later. But today's schedule, what do we hope to focus on? I feel like the picture on the right, I hear this just about every day, somebody kind of walking into this situation. They go to the doctor and they're like, listen, something's not right. And the doctor's like, well, everything looks fine on your labs, see you in 6 months, see you in a year. And it's like, wait a second, I just told you that something's not right. There's something wrong. So what we're going to talk about today is the connection between gut and brain health and why that's important. I'm not going to go into the nitty-gritty details. I don't want you to be falling asleep on me here today. But what I do want to talk about especially is anxiety, mental health, and the hope that we have because it's just so prolific right now between our children, all the way up to end of life. People are just struggling. And I think probably, as most of you know, the pandemic kind of broke the camel's back on that. Okay. We've got some new software available. Okay. We will also be talking about ADHD and then definitely some next steps, what is available through treatment as well. So if you were at the last session, we did talk about what is important to us at Victress Health on this illness wellness continuum. So when we speak to our patients, we speak about folks being generally coming to us when they're starting to have signs, symptoms, and disability. Our focus at Victress is to try and get people way on the other end of this spectrum to where they're living their best lives, because we want you to live well as long as you're alive. I don't want you to be, 72 years old and, already on a walker, already, barely able to get out of bed, on 30 medications. That's not our focus at Victress. Our focus is living as well as you possibly can as long as you're alive. Unfortunately, conventional medicine, as most of you probably know, will be able to get you through insurance approximately to symptoms, maybe signs, very rarely ever to the neutral point. Only if you're there for like your yearly physical and you're somebody who's kind of like middle ground, that's what insurance will pay for. It's an unfortunate reality that we live in right now, but it's also part of the reason why healthcare is so stinking expensive, because they're only paying for you when you're hitting way down here. You're starting to have problems. A good example of that we'll talk about later is some of the lab work that we recommend. So we'll talk about that as we kind of go on. But this is where I want you to be thinking for your health and for your family's health is, where are we at and why am I not over here? What could I be doing a little bit differently to get my family and myself on the on the right side of that paradigm. Oh, I can't do this backwards. I'm going to have to come around to this side. Okay. So, we talk about mental health. We talk about, despite advances in medicine, advances in science, we just know so much more. The problem is that life expectancy has dropped for the last 3 years in a row. That's increased suicide rates. We know drug-related fatalities are on the rise. This is unbelievable to me. And some of y'all might have, some better insight even to this. But how is it possible that we're consuming 80% of the world's opioids in the United States? That's unbelievable. And that's a real issue, especially when we know that most pain does not require an opioid. The research shows us that when you compare them side by side, Tylenol is as effective. And you guys probably have heard some of this research, and maybe some of you haven't. But it's because of the idea now that we have in our head that an opioid is better, that we will ask for that and take that. So it's really tough. Liver cirrhosis, we know alcoholism, it has jumped way up, and it's really challenging what we're facing right now. So why are we talking about brain health then, especially with relation to all of this? Well, obviously, suicide has increased. This is huge for us here in Shelby County, increased 40% in rural America in the last 20 years. That is unbelievable. Anxiety disorders are on the rise. We see it every day in our clinic. We see it in children. We see it in young adults. We see it in adults, middle age, even in our seniors now coming in with anxiety. So we also know, and the reason why we really wanted to hit on this topic today, that many of us are starting to come in with mild cognitive impairment at younger ages. So at 60, starting to show these signs. And then the other part that I think is so fascinating is that we're at the point, and this was 2018, so this is the most recent study that we had showing the actual numbers, but I know it's higher than that now, and I think it's underreported as well. But 1 in 6 U.S. children has a diagnosed mental, behavioral, or developmental disorder. So that's why we need to be talking about brain health. That's why we're here today. That's why this becomes so important. So the next thing we're going to get into, and I promise you I'm going to be really brief and kind of blaze over this, but the gut-brain axis is so vital to what we're talking about. I'm not going to go into the nitty-gritty detail. What I want you to understand is that there's a lot of bunk science out there. I can promise you this is not pseudoscience. This is not bunk science. There's so much research supporting the idea that what is happening here is affecting up here, okay? So what's happening in your gut is affecting your brain, without a doubt, okay? So what we're taking in on a daily basis is affecting what's happening in our brain, okay? And so there's lots of different ways for that, lots of different pathways. I'm gonna just kind of share just a couple of them on this next screen, but I'm not even gonna go into the detail. You just need to understand that any type of issue, for example, if you have a child that has, constipation, or, sometimes, even like a diarrhea every once in a while type thing, or, things like that are going on. It's something you need to be aware of, and it's something you need to be talking with your provider about. Not so that they'll say, oh, well, here's some Miralax, it's pretty safe. It's not that. It's like, what is happening? Why is this happening? What is underlying that? So we bring this up just so you guys can understand there's a lot behind this. We know also that there's significant differences in the gut, so in the microbiome, of folks that are associated with various psychiatric disorders. So think about it like this. This is what's so fascinating to me. Folks with depression, bipolar, schizophrenia, and autism have vastly different microbiomes when we compare them side by side with somebody who's, quote unquote normal, or like the control, okay? So it's amazing to me that we can look at this and we can pinpoint and say, that person likely has bipolar based on looking at their microbiome, okay? So it's fascinating, and it's something that we need to understand. This is why it's so important, okay? We talk about enhancing beneficial bacteria and that it has the potential to improve mood and reduce anxiety. This is what, we love this. We've spoken about this before. If you've seen Lisa and I talk at any point, we talk about this study because I love this study. You ever just have a day or two or a month where you are just like grumpy? You know, Lisa and I talk about this, you know, sometimes as moms, we just are grumpy. And I'm like, oh, I'm just in a grumpy mood. Well, this study actually shows us what can be happening with that. So this is so fascinating. They took these people and they started out showing them neutral faces, right? So it's funny, if you show your kids these pictures, they'll say, oh, the lady on the left is grumpy, but the guy on the right is not, you know, or they'll like pick it out kind of like that. But they had all these people with neutral faces. They're not grumpy, they're not upset. They just showed them, you know, not with a smile on their face, just like these two images are. So prior to administering probiotics, the people had a significant negativity bias for these neutral faces. But then after receiving the course of probiotics, these same folks would rate the exact same images as being more pleasant. So it's funny because it's like, you know, when you go through that period of time where you're just like grumpy and, oh, that person's out to get me and, you know, things like that. And it's just like your brain kind of like cycling through that. Might it be time to run a course of probiotics to kind of get yourself back on track, right? So the other thing that's interesting about this study is it doesn't mean that, oh, everybody should just be on a probiotic all the time and then everybody will be happy. We know that the effects were temporary. So it suggests that we do need to do other factors of healing. So it's not just like, probiotic for you, probiotic for you. It's like we need to be thinking deeper also, okay? But it's so fascinating, right? So you can literally change a little aspect of that microbiome and have completely different feeling about neutral faces. I love that study. So, I mean, this is part of what we talk about at Victress as well. You know, sometimes we can just get so wrapped up in the bad stuff, right? You know, look at all these good things happening, but, you know, we're so hyper-focused on the bad. And we'll talk a little bit more about, you know, ways that we can kind of counteract that as well. So let's get into a little bit of anxiety and mental health. So we're going to talk about kind of, I'm sorry. We got the same slide here, but we talked a little bit about, you know, mental health and why it's important. But I think the other thing that we want to bring up with folks is the importance of something called insulin resistance. So the way that I describe insulin resistance to people is generally if you are somebody who you feel like has a little bit of extra belly weight, you know, especially around your middle, or if you're very affected by missing a meal, or if you're somebody who's like, you know, lightheaded if they don't, you know, eat on time, or, you know, if you have a child that's like, you know, gets super cranky if they haven't had a snack, or, you know, things like that. That's one, you know, kind of easy way of starting to identify some insulin resistance issues. It doesn't mean everybody. There are some people that do need to eat more frequently, things like that. But we would want to be testing for that if you started to see any of these types of symptoms over here. So the reason we test that in kids a lot of times, so if you bring your children to Victress, we will test, we'll do some blood work if it's okay with you. We'll have them get their blood work done, because children with high levels of insulin resistance starting at age 9 are 5 times more likely to be at risk for schizophrenia or bipolar by the time they hit 24, right? So we know that that's affecting their microbiome. So it's like, I want to know if my child's starting to trend down this path of insulin resistance at an early age, so I can start to cut off some of this stuff. Now that doesn't mean that they can never have ice cream again, or, you know, that we have to completely change everything we do, gluten-free, dairy-free, you know, the whole thing. It's not like that. It's like, what are small changes that we can start to make as a family so that we can trend them out of that insulin resistance and into health. So this is just another kind of picture of understanding what insulin resistance is. So basically what we're looking at is we start from here. We start with chronic carb consumption or, carb cravings. And part of that is the food that we eat is addicting, right? And we know that. And truly, seed oils, the processed foods, they are addictive. Science shows us. It's not just us saying, oh, an Oreo sounds good. It is actually addicting to us and to our brains, okay? So increasing that carb consumption, your blood sugar goes up, your pancreas has to secrete more insulin. Your cells then start I don't really want to take this in anymore, so they start to resist the insulin. Then your cells start to struggle to produce enough energy, so you start to get more fatigued. Well, then more insulin is produced because you're exhausted. Then inflammation starts to get promoted, so you start to get the weight gain, the joint pain, the brain fog, all that. Well, then guess what? Your insulin is still going up. Your carb cravings continue. You need to eat more. Your blood sugar goes up, and it's this vicious cycle that just keeps going and going and going unless we identify it and figure out a way to stop that. And there's some easy ways, and we're going to talk about that as well. So this is interesting. I think when we went to PDF, we kind of jumped around a little bit, so I'm pulling up a different one here. There we go. Okay. So when we are talking about, some other things that we can kind of be looking at, we already talked about how your microbiome can be significantly affected by even just a simple addition of a probiotic. Well, even more interesting is that there's such things now that we know of certain strains of probiotic that specifically become almost as effective and as effective sometimes as antidepressants. So we took this particular strain, this Lactobacillus rhamnosus strain, and it became as effective as Prozac when treating as an antidepressant. The other one that I think is so interesting is this Bifidobacterium longum. We take people that are under chronic stress, and when you're under that chronic stress, if we give you this Bifidobacterium longum, we are able to reduce your anxiety, depression, obsessions, paranoia. There's so many things. And so we're looking at these different strains, and I won't go into detail on each of these, but just understand that, this is why we highlight it. Working better than Celexa, working better than an SSRI antidepressant, okay? So next time you have a family member or you that's feeling down and out, it doesn't necessarily mean that you need to go and be on this prescription forever. It's like, what else could we be looking at? Could we be looking at root cause a little bit more, fixing your gut, and maybe even just adding in one of these strains? And I'm going to give you, we have a couple options for that on Victress on our Shopify store. And again, you're always free to shop around. I'm never trying to, promote that or push that in any way. I just want you to know that you have an option, that we source everything as best possible. Okay, Alzheimer's disease is another one that we always just kind of like to touch on. And the big reason why we touch on Alzheimer's disease is because it feels so, when you have a family member that has Alzheimer's, it's so all-consuming, and it's so, I don't want to say unbearable, but it's so challenging. And we begin to feel like, it must just be the genetics. It must just be, I'm the one who's next. It's my mom had it, my grandpa had it, it's coming down for me. And what we understand now is that even though we have all these folks that are starting to have Alzheimer's, and we're starting to see that, what we're learning is that with Alzheimer's, it's essentially can be a form of insulin resistance. So we can literally take somebody who's 30 years old, we can look at their lab panel, and some of them are the ones that we're going to have you, we're recommending on that brain health sheet that we gave you. We can look at their lab panel at 30 years old, and we can predict who's going to have dementia later on in life. okay? So it's that important that we start to look at those things so that we can curb them and turn them around. It doesn't mean that you're just stuck with that and, oh, I'm sorry, you hit the genetic jackpot and you're on your way to dementia, okay? So understand that. These are the strongest risk factors for Alzheimer's by the age of 35. So that's all on the brain health sheets. Those would be part of what we would want you discussing with your care provider. Now, Parkinson's, this is another one that's so fascinating. Research coming out that Parkinson's, again, it feels like, oh, you know, my dad had Parkinson's, my grandma had Parkinson's, you know, I'm just, again, hitting that genetic jackpot of getting it. No, we understand now that it's literally an autoimmune condition, okay? So when we have somebody with an autoimmune condition, we understand that there's things that we can do to reverse that and kind of get things moving in the right direction. Now, there's some patients that come to us, they've already started down, you know, pretty much how this gentleman looks, you know, very rigid, you know, very tight with their face, not turning at all with their head, you know, kind of like starting into this walking pattern. Those are really tough for us to like completely turn around. Oh, yep, you're going to live a normal life and go back to playing tennis on your own. However, if we can start to catch these at a much earlier time, maybe when somebody just starts with a little tremor and they're like, man, I don't really want to deal with this right now. Please deal with it. Get into your doctor. Ask these questions. Get started. It's probably, if it is actually Parkinson's or something on the way to Parkinson, it's an autoimmune condition. And we can start to talk about reversing these things, okay? Don't just take from the doctor, well, let's just wait until it gets a little worse, or, you know, any of those kind of bunk answers. No, we want to start addressing this. We want to address it from a gut level too, especially. So again, I just want you all to have hope, because I think sometimes we get so stuck in the idea like, oh, well, that's just, you know, diabetes is in my family, or Alzheimer's is in my family, or Parkinson's is in my family, or depression runs in the family. That doesn't have to be what you're stuck with, okay? You can have the hope that we can change things around. So ADHD and behavioral issues, another big one that comes up a lot in our clinic, because it's like a lot of moms or dads that have really tried hard with their kids to figure out, you know, what is underlying this, you know, what could be going on. So these are just some of the things that we'll find with behavioral issues. We see a lot of food sensitivities. We also see a lot of yeast overgrowth. We also see a lot of environmental toxins. So mold exposure is a good example of that. I know we actually moved into a house and we're renovating it as a family, and it was like my worst nightmare came true. We found mold like everywhere. It was like, stop everything and put everything on hold. You know, everybody needs to be protected. No kids in the house. You know, we need to get this taken care of, because environmental toxins, specifically mold, you know, working on our system can cause so much damage and behavioral issues, especially in children. So there's so many things. This is why we don't want you trying to figure this out on your own. And we don't. You know, even with my own kids, especially when it comes to behavioral issues, I am bringing them into the clinic because I will just keep like, oh, maybe it's this, maybe it's this, maybe it's this, maybe it's this. I need Danielle, I need our providers' help to help me to think through, okay, what's the next logical step for us? What lab should we do? What, you know, food should we potentially pull? What are the things that we should be doing to make sure that we're, you know, getting our kids back on track? Now, the other thing that I'll say too, you know, one of the things that we see a lot is like parents that come in, and I'm sure you guys have seen this, you know, in your own kids, and I've seen it in my kids for sure. There's a big difference between a child who has, you know, severe behavioral issues or behavioral issues that are impeding, you know, everyday life. Not just that they're excited in a classroom and can't sit on their butt and their teacher's like, your child just doesn't sit well. I mean, there's a big difference between that. You know that as parents, you know which ones are the ones that are, you know, more challenging, which ones are the ones that are just wiggly and need to move more. We talk about that a lot in the clinic too, because unfortunately that is a problem in society, is, you know, teachers just struggling to kind of keep up and ending up, calling mom or dad, hey, I think so-and-so might have, ADHD or, things like that. So it's definitely something to talk with your provider about to kind of navigate, what is a problem and what is not. Okay. So now what we need to talk about is, let's say you have these issues, somebody in your family has one of these issues, what is going to be your next best step? So a lot of what I put on the page for healthy brain habits are really going to be what we're going to be going into over these next few pages. Now, some of you might need to go to the extreme. You might need to, for example, with sleep, I'll go to the next slide to just kind of show you, and then we'll go back. Oh, well, little humor. Some of us might need to go to the nth degree and really work on circadian rhythm from beginning to end of the day, okay? If you're not sleeping well, or if you're waking up every single night, and you can't go back to sleep, or you literally can't fall asleep for like 3 hours because your brain's going, or, something's off, or, you've got things going on. I have patients that'll come to us and say, I cannot get more than 3 hours of sleep a night. We might need to go really and start with each of these steps. Seeing morning sunshine before you pick up your phone, 10 minutes. Doesn't matter if it's raining. You got to get your eyes outside. The window doesn't count. The window takes out some of the rays of UV and doesn't allow us to see this full spectrum of light. Okay, so that might need to be you if this is your issue, or somebody in your family that's having trouble sleeping. You might need to sit up and watch the sunrise and then watch the sunset. You might need to wait an hour before drinking coffee in the morning. That's really hard to do. I love coffee. I love it. The smell of it, the everything about it, I love it. But I do my darndest to make sure that I don't drink that caffeine before 1 hour. And the reason is because our body naturally will give us a boost called cortisol. It's a cortisol awakening response. It allows us to wake up. Sometimes we've ignored that for so long, or stressed ourselves out, burnt ourselves out so much that that's kind of a blunted response. But adding caffeine to that will continue to blunt the response. That's why we allow our body to do its job, wake ourselves up a little bit, and then we can add some caffeine to that because we like the taste of it, because we want the little extra boost, or also because it's actually fairly healthy for us to do that for most of us. Or we might need to have a really strict bedtime routine like you're a baby again, like how they would tell you if you were a baby. Okay, first we read a book, then we do a bath, then we turn out all the lights, then we have no overhead light, now we only have lamps on, no screens at all, reading books and magazines instead of screen, you know what I mean? Like you might need to go to that degree. What I'm telling you is not everybody needs to go to this degree with each of the things that we're going to be talking about. So you need to figure out what's the next best step for you, okay? So as we kind of go through this, same thing with diet. You might need to be somebody who needs to be fairly strict. What we know is that for brain health, also, this is really fascinating. I just read this study the other day. When we have diets rich in polyphenols, so those are like those brightly colored things like berries, even like coffee and tea. I'll show you some images on the next screen. Those who had a diet rich in polyphenols not only suffered less comorbidities, so like, less heart attack, stroke, things like that they lived through. They suffered less premature deaths, and they weighed less than their counterparts who didn't eat as many of the polyphenols, okay? So we'll get into that a little bit more on the next slide. But generally, as we're talking about this, and this is where we kind of need some help sometimes from some practitioners, but generally you want to be more of like a Mediterranean focus. So that's going to be more of like seafood, berries, olive oil, greens, we also say grass-fed beef, absolutely, some chicken, some turkey, things like that. But it should not be entirely, should be kind of somewhere in the middle. Does that make sense? Most of us. Now, again, we need to personalize, but that's what we generally say. So these are some of the things that are going to be higher in those polyphenols. So when you're cooking, using herbs and spices, eating more nuts, veggies. Again, most of us can tolerate increased veggie intake. Olives, avocados, cocoa, egg yolks, coffee and tea. Now, the other thing that I think is really important about this does not mean that you should literally wake up and every day eat the same thing. Okay, well, I'm going to have a smoothie and I'm going to knock off berries, nuts, and avocados and, whatever. And like, that's what I have for breakfast. And then for lunch, I have a sandwich with egg yolks and you know what I mean? Like you shouldn't be doing the exact same thing every day. It's not good for our bodies. Variety is good. Seasonality is good. So even though these things are fantastic for you, eating them every day and the same things every day is not, okay? So just kind of understand that it's and again, not to scare you and not to like get you out of these healthy habits. Just the idea is that our bodies, if we continue to eat 5 servings of berries every single day, breakfast, lunch, and dinner, we can build up in some things that aren't so great for us. Now, again, across the board, there's very few things that I can tell every single patient. Every single patient that comes in, I'm going to tell them what's up there right now. Get rid of the ultra-processed foods. Get rid of the artificial flavorings, food colorings, and preservatives. Absolutely, without a doubt, get them out of your life. If you are struggling or if you are concerned about brain health at all, this is what we should be doing, is getting rid of those. Now, what is an ultra-processed food? And Oreo is a great example. Where did that come from? Can you figure out and identify like any part of that where it came from, right? It's really difficult. And I'll use the example, actually, I'm seeing like tortilla chips on people's plate. That's really not that far off. You can identify that a tortilla chip probably came from a couple of things. It came from some corn, and then it was fried in some oil, right? That's not that horrendous when we're talking about the processing of foods. Does that make sense? Now, the oil that it could be fried in, we could always make better choices than what, I don't know, Tostitos fries them in. There's always better options. But again, when we're talking about the spectrum of food, it's like if we can get rid of the Oreos and replace them with maybe some chocolate that's literally from, cocoa and sugar. Great, we've done it. That's going to be a huge impact, okay? So it's like kind of making those different swaps, like what can we swap out, okay, to kind of get yourself back on track. Now again, this is where I'm saying you might be somebody though that needs to go a little bit more to an extreme. Are you somebody that needs to try an elimination diet? So an elimination diet is when we say, okay, you're really stuck. This is something you've been working on for a little while, and we need to eliminate certain things. Like a lot of times for people, that'll be gluten, dairy, soy, corn. You can kind of go down the list, okay? So that might be you, if this becomes the most important area for you. Next thing that we are telling everybody, no matter what, routine lab work. And for us, routine lab work should always include these 6 items. Okay, especially when we're talking about brain health. All right, now not only these items, but absolutely should include these items. And I guarantee you, unless you are either asking your doctor about it or diabetic, you're not getting all of these first 3. Almost everybody will get fasting glucose because they'll tell you to fast before you go in. Fasting glucose almost is always checked. What's fascinating is fasting glucose is the last thing to show us that our blood sugars are out of whack, okay? First, fasting insulin changes, then A1C changes, then fasting glucose changes. So why in the world would insurance only pay for fasting glucose in the normal population? But guess what? That's where we're at, and that's why you need to ask for these things. So when you go in for your annual physical, hey doc, please add on fasting insulin and A1C. It's not going to be that much more expensive. They might need to put an additional note on your chart or additional code for you to get those run through your insurance. But that's also why we don't deal with insurance, because I don't want insurance telling me that I need to do their archaic ways of treating folks when I know that if I check fasting insulin and A1C, it's going to show me a problem about 10 to 15 years sooner than fasting glucose will. Okay, so that's how significant it is. That's how important this is. I'm also going to check cholesterol and triglycerides. And then last but not least, now this is really important, vitamin D. When you ask for that, your provider might try to scare you away and say, oh, your insurance isn't going to pay for that. They might be right. What I would tell you to do is, generally, if they say that, or if you go to the lab and they say, oh, your insurance isn't going to pay for vitamin D, have them run that at a cash pay price. So at Victress, our cash pay price for vitamin D is $22. That's how much our patients pay when they get their vitamin D levels checked. When somebody says to us, hey, you know what, I'd rather use my insurance, I think I'm going to get it covered through insurance, we say, no problem, that's fine. What happened the other day, we just got somebody who came back to us and said, I thought my insurance would pay for it. $422 later. $422 later for running that vitamin D labs through her insurance. So don't be scared off of getting your vitamin D levels checked. Just be smarter about it, okay? Ask for the cash pay pricing. They might, well, we don't really do that, whatever. I don't care. I need to find some way of getting that done. And if you need help, you can call us. I'll be happy to walk you through it, okay? It's that important that we get this done and get that vitamin D level checked. Okay, these are some of the things that we talked about before. So we talked about those psychobiotics. That might be the next most important step for you. We use a couple. If somebody's struggling, with anxiety, with coping, there's a great product we really like to use called ZenBiome Cope. That's fantastic. It's worked really well in folks. Same with ZenBiome Sleep. It's just another, it's not got melatonin in it. It just works, it helps to calm your body down for sleep. It's not going to knock you out like a Xanax would or, something like that. It's not like that. It's not a prescription, but we really like using these products. The last one is if we've got somebody who's really struggling, depression, anxiety, really kind of a mess, they will call themselves a mess, and we would never say that to them or describe somebody that way because we're all a mess sometimes. But Pro Brain Biotics Max is fantastic. There's so much research behind that product. So we'll use that one in conjunction a lot of times with some other things to kind of just help calm their system down a little bit. So that's a really good choice. The other thing that you might need to do are some targeted supplements. We talked already about some of the things that we can do to just kind of calm everything down. We talked about those polyphenols. Here's some of those spices that can really be helpful. Turmeric can just kind of cut inflammation out. Cinnamon, we actually essentially, quote unquote, prescribe cinnamon to anyone that comes into us and has an impaired fasting glucose or fasting insulin response. So if you come to us and you're like, had my labs done and I don't know why, but all of a sudden my fasting insulin or my fasting glucose is off the charts and that's not normal for me. Our first step is going to be to have you add this after your largest meals, cinnamon. It's so simple, but we can just do a capsule. Other people say, you know what, if it's just cinnamon, then I'm just going to start adding it to my meals. That's totally fine too. Now, we do know that there's a prescribed dose that will actually help you, with kind of impeding that response. But that can help people sometimes just get started, just get moving in the right direction. Ginger, another great one that actually has just popped up lately as being an excellent weight loss tool. Ginger and cinnamon, both for weight loss. Along with, and that's not on here, so if you want to take a note of this, apple cider vinegar in combination with cinnamon and ginger. So it's not like you need to take all three at the same time. That would be so disgusting. But apple cider vinegar in conjunction with cinnamon and ginger, fantastic for weight loss as well. Again, really awesome. Methylated B vitamins are another way that we know that we can support brain health. So if you're somebody who's a brain fog person, absolutely, you need to make sure, you need to flip your multivitamin over, and you need to make sure that it has, and it says on there that your B vitamins are methylated, that the specific verbiage on there. And if they're not, it won't say it. It'll just say vitamin B1, B2, B5, it won't say it on there, okay? So it'll say like methylcobalamin, or it'll say methylfolate, okay? So you'll see that on your label. Generally, if you're getting that from Kroger or Walmart or Amazon, chances are, if it's inexpensive, they're not methylated, okay? It's not a good product. So methylated B vitamins, super important. Vitamin C, another one that we can put up there with those awesome weight loss supplements. If you don't have enough vitamin C, your body has a really hard time processing and eliminating fat. Just part of it. Now, another one that we use, and the reason I linked this on here, I just want you guys to know that something like this is available. If you're really struggling with anxiety, depression, brain fog, and you're like, I'm not quite ready to call Victress. I'm not quite ready to change. I'm not quite ready to jump in, with a new provider or a new place. Talk with your doctor about this study. This omega-3 plus a multivitamin plus this supplement called Brain and Memory Power Boost. It's actually, I'll click on the link. Hopefully it'll work on here. But maybe it'll take me and we'll never be able to come back to this. But what this is showing us is that they did a study, and it was a small study. It's not perfect, but they took former NFL players that all had severe concussions while they were playing. And they were all retired. And they said, okay, we're going to give you these supplements in addition to educating you on things like nutrition and weight loss and exercise. Smoking cessation. You shouldn't smoke so much. So they educated them, okay, just kind of like what I'm doing today, and they had them all start with this supplement. And they had these folks do it, this supplement. So it's expensive, right? You're looking at it, you're like, oh my gosh, a 30-day supply, that's expensive. All they did was use that supplement from anywhere from 2 months to 12 months. And they showed significantly improved memory, mood, brain function, all as a whole, okay? So these are guys that had really severe, challenges, post-concussion syndrome. And in just adding, this, and, maybe some of them, they didn't even quantify, did they lose 50 pounds? Did they lose no weight? All they did was educate them on these things and what they should be doing. And in doing that, these guys just demonstrated significant return. So I bring that up because I just think it's important that you know that there's things out there that can be helpful. Okay, now let's see if we can ever get back to this. I don't know if it'll work or not. Hey, there we go. Okay, another next step. So this might need to be you, especially if you're somebody who's suffering from anxiety and depression. If you have a child suffering from anxiety, depression. There's an absolute correlation between social media and mental health, okay? Absolute. If you have a child that's suffering from any type of mental health challenge, take it away. And I can only say that as a parent myself. I've done the work. I've done it myself. Take it away. Even though they're going to say, oh, I'm going to miss out, and the whole FOMO, and, I won't know what's going on, and, whatever. Take it away. When we take away social media, we have so much improvement in mental health. So starting maybe just 30 days. Can you try 30 days? Can you try 60 days? Can you do it as a family? Can we just shut it off? Can we just be done? Okay, yep, you're gonna miss a couple of things. I missed out on, oh my gosh, it was my brother-in-law's birthday. And apparently the only thing that ever triggered me that it was his birthday was social media. Whoops. But like things like that, you're going to miss some things. You're probably going to miss, oh, so-and-so had a cookout, whatever. You're probably going to miss some things. But what you won't miss is the increased depression, memory loss, and poor academic performance. Part of it, the other thing that you need to address, and you need to address it with yourself, you need to address it with your children as well, is why do I feel the need to zone out? Like, you literally are zoning out when you're scrolling. When you're TikTok or when you're, Facebook, and when you're just scrolling, when your finger is doing this, you're zoning out. Why do I feel the need to do that? What am I not addressing? Like, what's underlying that? I know I'm stressed, but why can't I just do some deep breathing and kind of, work through that a little bit? Is there some trauma that I'm not dealing with? Is there a situation that I need to address? What is underlying this? And it's important to talk with your kids about that too, because it is easier. It's so much easier to just keep scrolling and scrolling, okay? And also know that you're not the only one that's not letting your kids do social media, by the way. Here I am. Here's one, right? But understand, your kids are going to say, I'm the only one. No, you're not. You're not alone. Here's the other thing that we talk about. So at Victress, we'll talk about prayer. We'll talk about having just an increase in prayer time, just starting with 10 minutes. Evidence shows us if we can get you to just sit quietly, focused on, again, we would call it prayer. Some folks would call it meditation, just quiet time to yourself. Then we can demonstrate significantly improved cortisol levels and stress levels, okay? So when we do that, we know that we're getting our guts in better shape. We know we're also getting our brains in better shape. So when can I carve that out of my busy day? I'm kind of running out of time, so we'll kind of jump into some other things. I know I also put on there too about the importance of exercise, and I don't want you to think like, I'm not up here preaching to you and saying, yep, get on that treadmill for 60 minutes every day. We can split it up. We know the research shows us that if you literally take the steps, and then the next time you walk your dog for 10 minutes, and then, the next thing you do, you go and you clean for 10 minutes. Adding all of that together is enough for our body to feel the effects of that. The important part is not to just sit on your butt, okay? It's easier, right? It's easier to sit and scroll. But what we need to do is understand, I'm not telling you that you have to go and lift weights for 60 minutes. I'm telling you that you need to move, okay? That's it. Now we talk about health. This might be the next important step for you. We might need to dig deeper. You might be somebody that we really need to get to the root cause. We know conventional medicine or Western medicine that we talk about really just kind of separates everything out. It's like, you need to see the gastroenterologist or the cardiologist or the ologist, whatever, okay? What we talk about is why are you having all these symptoms that are presenting in this tree up here? What is underlying that? Is it truly genetics? Is it nutrition? Is it stress? Looking at all these different angles, okay? The other part, and I'll just kind of skip through this, we talk about functional medicine, kind of really getting to the root cause. This might be something that you need to do, and we would have a discussion about that. Same thing with primary care. This is the way that primary care works traditionally. You got to go through your insurance before your doctor can really do anything with you. There is nothing that they can do really without kind of making sure. Even making appointments. You know that when you call in for an appointment, they literally have different appointment times booked out for different things because of insurance, right? And because of reimbursement levels. So even calling for an appointment. Typical visit times for traditional doctors are actually for a year, over a year, the traditional time that you'll spend with your physician in conventional medicine is 8 to 13 minutes for a year. That's why we decided to go with a different model. We call it direct primary care. It is something newer to Shelby County, but it's not new to the United States. We basically take out the middleman. We just charge you a membership fee. You can come in and do as much as you want with us, as much as you need. Texting, calling, you will have the provider's number. So that way you don't have the middleman. This is what we were talking about with our labs. Here's the labs that we typically will do. So I'll just kind of pull up one of them that we talked about. So here's that A1C that we were talking about, hemoglobin A1C. you can see what our price is for that, $7.28. That's exactly what we charge you when you come to us, okay? And we say, okay, this is what we need run. And we can show you that every single time. Tell me an insurance company or anybody in conventional medicine that could do that for you, right? It just doesn't happen. They don't know. So this is why we wanted to kind of really be an open book for our patients. So again, all I want you to know is we might be the next best step for you, but most of you, maybe some of you, have a really great relationship with a provider, and you can bring this information. Hey, this is what's happening to me. I learned a little bit about this. Can we talk this through, okay? Some of you might need to come to us. Some of you might not have a provider. Some of you might not have a great relationship. That's totally fine, you know. But I want you, if you have a great provider, stay with them. I'm not telling everybody to change to us. We can't handle all of Shelby County, but we can handle some, okay? And so I think that's important, that if you have a great relationship, go for it. So that's really why we kind of talk about these things and why we bring this up. We're just open and honest about everything that we do. Sorry, I'm trying to get to the last slide here. We do have a podcast if you are ever interested, and then this is what I really wanted you guys to see too. If you're not sure what your next step is, do not hesitate to call. It's my job to direct you down that path. I might be the one that's saying, you know, actually, all you need to do is bring these 10 labs to your provider, and you're probably going to get most of your answers right there, okay? So that's my job, is not to try to convince everybody to come to Victress. That's not ethical. That's not what Lisa and I really feel is important at Victress. My job is to educate you and figure out what is going to be the next best step for you or for your family member, okay? So I'm so sorry. Technical difficulties limited me from being able to answer too many questions, but we do have 2 minutes left if anybody has questions in 2 minutes. Otherwise, don't hesitate to reach out. I think I put my email or my phone number on there as well. Yeah, my phone number's on there, and then you can always do the free consult.